John Paul Okorafor,
Wana Etuk,
and Matthew Nyakura.
Together, we are Team Sigyn, and today we're presenting to you a revolutionary idea. It's a plan to connect African hospitals and even hospitals beyond the continent on a unified, secured medical records platform. We're calling it Project Saturn. So what is Project Saturn? Before we go into the details, I'd like to tell you a short story. You see, in 2014, I was a medical student somewhere in a place called Benin City in Niger. And we had a patient who was rushed into the emergency room, a 10-year-old boy. We'll call his name Michael. Michael had something called Stevens-Johnson syndrome. You see, Stevens-Johnson syndrome is a very deadly allergic reaction to certain medications that you take when you're not supposed to take them, when you're allergic to them. And we asked ourselves, who gave Michael these medications? Didn't they know he was allergic? And we took history and we discovered what happened. 6 years prior to this time, he was taken to his family clinic where it was noted that he was allergic to these medications. They noted it in bold and in capital on his case notes. However, the hospital still used paper-based systems as opposed to electronic medical record systems called EMRs. So 6 years down the line, he came back to the hospital and they couldn't find his records. They couldn't find his case notes. So they did what every other hospital does. They basically just opened a new folder and treated him like a new patient. He was given the same medications, and unfortunately, 2 days after he came to us, Michael died in our ICU. We asked ourselves, what killed Michael? The truth is, Michael didn't die because of the medication. Michael died because of an inadequate data record keeping system. And this is the problem that we at Team Sigyn are trying to solve with this project. The problems are inadequate healthcare data and the fragmentation of this data. You see, our data is still in many hospitals across the nation and across our localities, and this data does not communicate with each other. But we asked ourselves why. Why is this the case? And so we discussed with key stakeholders in the industry, in the healthcare industry in Nigeria. And after all our discussions, we were able to distill 3 key issues. The first was this: resistance to change. There's this inertia to change. Some people are just comfortable with what they know. Secondly, we have inadequate infrastructure. In some parts of Africa, there are still obvious infrastructural deficits like power, and you cannot run an electronic medical record system without those kinds of infrastructure. And thirdly, probably most importantly, is the high cost. EMR systems are really expensive. By EMR, again, I mean electronic medical records. They are high cost, they are expensive to deploy and maintain. So what's our solution? Our solution is still an electronic medical record system, but deployed in such a manner that it is low cost and scales these infrastructural deficits. And with constant training of the healthcare staff, it will be so easy to use that there'll be little or no barriers to adoption left. To talk us through the key features of this EMR system, my colleague Matthew will continue the conversation from here.
Thank you. So to resolve these pain points that have been identified, Saturn has been designed with 6 main unique features. Going counterclockwise from the left, the main feature is the electronic patient record feature, which enables more accurate diagnosis and treatment and would have prevented Michael's death. A second feature is the electronic billing, which enables better and more transparent financial record keeping, verification, and reporting. The inventory management feature enables medical and other supplies management and helps to avoid critical stockouts. The patient appointment scheduling feature enables better service delivery and customer satisfaction. Saturn will also provide insights on diseases, supplies, health trends, etc. for hospital management, pharmaceutical suppliers, and governments. The third-party integration feature will enable Saturn to exchange data with other systems with diverse functions, like fitness trackers, for instance. These features are integrated in a unified, user-friendly, and cloud-based solution, accessible and targeted at African health institutions. Central management makes Saturn easy to maintain and cost-effective due to economies of scale. Most players in the market already address private sector health institutions, which we consider as a red ocean. We intend to target mainly health institutions in the secondary health sector, which includes government and private hospitals with large patient volumes. An additional market identified was provision of health data and analytics to government and international NGOs. These will ensure that in spite of the presence of strong competitors, Saturn will have its place secured in the EMR solar system.
I would like to talk about our competitive strategy. But before we discuss strategy, we must first of all recognize who our competitors are. Our competitors are firms like Helium, Athena Health, eClat. These firms offer EMR services, but their services are so complex that they require medical personnel to learn how to use the platform. So in order to compete in this market, we will adopt a low-cost differentiation strategy by taking advantage of the following. 1, the ability of our platform to scale quickly. 2, the simple user interface will ensure that medical personnel are able to use the platform without prior training, just log in and use. And 3, our access to niche markets will enable us to drive growth of our platform and the productivity of the organizations that adopt our platform. Because at the end, we don't want to just impact Nigeria, but want to impact Africa at large.
The positive impact of this project includes integration of all health data on one platform, data bank, accessibility, and planning. Accessibility of accurate health data will help government and stakeholders plan interventions properly. Our sustainability concept will link Africa Agenda 2063 number 2 and 3 with the United Nations Sustainable Development Goals number 3. This innovation will ensure healthy life and promote well-being for all. Environmental safety is assured because we have a low carbon footprint and our development plan is achievable as a team.
Talking about the development plan, we are currently in the ideation stage, and we are going to run a pilot with 5 hospitals before we eventually commercialize and launch. And we are going to monitor this process and the performance of Saturn through KPI, that's key performance indicators, in order to track performance. For Project Saturn, we have 3 pricing options. We have Basic, Standard, and Pro Max. The Basic is going to offer electronic health records, which is going to be at a rate of $150 per month, while the Standard is going to incorporate the billing interface and is going to go at a rate of $200 per month, while the Pro Max is going to include all the unique features that had earlier been stated. To launch Saturn, we will need an initial capital outlay of $32,000, and we're going to have 2 revenue streams, subscription-based model and per patient use model. Just like we stated, we're going to run a pilot with 5 hospitals and estimate to increase our hospital base to 15 by 2025. And in order to encourage adoption, we are going to deploy incentives such as data subscription, incentive, computer provision infrastructure, and we estimate to break even from our operation in year 2, which is 2024. And from our financial analysis, given the dynamic nature of the economy, we expect that we are breaking even in year 2 with a return on investment of 17% in 2024 and 19% in 2025. Now, if we experience our worst case scenario, we estimate to break even in year 4, while for our break even, for our best case scenario, we estimate to have a return on investment of 54% in 2024 and 65% in 2025. So why not join us and let's help Michael's legacy live on by revolutionizing our healthcare system and thus make Africa a great place for you and I. Thank you.
Wow, amazing and right on time. What a great job. Okay, if you want to, team, stop sharing your screen, and at this time, we will have some of the judges ask questions. Nareti, I see you finally made it online. Why don't we open questions with you if you would like to ask something?
Yes, thank you. Fantastic presentation. That's really great. So well done, Team Saturn. I just have a few questions. Let me start. What I wrote here is, what is your plan against or mitigating the policies of the government? Because again, they are the biggest stakeholder when it comes to the health sector. How far do you have relationship with the stakeholders like the Nigerian Information Technology Development Agency, the NCC, and also, of course, the Federal Ministry of Health? You know, what's your relationship with them? Because it's important in this scheme of things. And what you've done, it's really great. Again, what's your sustainability strategy? It would be nice to know that, since it's a subscription model. You know, I would like to know that. Your presentation is great, and I guess that I would like to just get the answers to this while my other colleagues will ask the rest of the questions. Thank you, guys. Well done.
Thank you. Thank you for the questions. What are our plans around governments? So, you see, it takes a while for government to trust you, especially when you're starting out. So first of all, we intend, because we are going to run a pilot, we intend to start and really fine-tune our process. We intend to really fine-tune our process and make sure we have a seamless model that actually works in the real market. When we've perfected that, we're already in talks with key stakeholders, such as stakeholders in the Lagos State Hospital Management Board. Luckily, many of them have close ties with our business school, the Lagos Business School. And in fact, one of them actually was our mentor in this project. So we've been in close contact with them right from the time the idea came up. And we intend to really keep close ties with these key stakeholders, because the truth is that we can't succeed without, it will be more difficult to succeed without their support. So yes, that speaks to the issues around government. But issues around sustainability, I will let my colleague, Wana, take over, answer that.
All right, regarding sustainability, we're coming up with a plan of, we plan, we act, we do, and we also think about reaching out via the SDG goal number 3, whereby we intend that the innovation will promote well-being, especially not just in the rural area, but also in the urban sector. So this concept of sustainability has to do with more of health, then the less or no carbon footprint. And finally, we are looking at continuous improvement in the system once we start this particular project. Thank you.
Thank you, team. Peter, I see your hand is raised.
I wanted to actually add to what my colleague said.
Oh, apologies.
Okay, also in terms of the sustainability of the business, I understand that the whole subscription-based system may feel out of touch with Africa, but the point is, when you offer organizations the first month free of a platform, we want you to embrace the value we are interested in giving the organizations. We need the organizations to embrace this value. By the time you've embraced the value, you discover that whichever system you have been using before was incur excessive cost as compared to you just paying the subscription fees. So it's more like, it not only a question of an opportunity cost. Do I want to incur more costs by going back to my former system, or do I want to just incur less cost by embracing the Project Saturn? So that's with that with that philosophy, we'll be able to ensure that this business is sustainable. Thank you.
Thank you. And actually, if we can, Yawadin, I think this is the first time you've had your hand raised. So if you don't mind, I think we will go to her for a question, if that's okay.
Hi, everyone. Thank you. Fantastic presentation. Well done. Such a huge need in Africa for this, I think, all across the continent. It would be good for you to include a bit more detail on the strategy you have on how you're going to cross borders. As you've said, like some of the challenges that you have within Nigeria, then is going to be exponentially harder as you go across other countries. So maybe partnering with institutions such as Africa CDC, even the UN ECA that's taking a lot of health initiatives will be good. So as you just, work through this, different institutions to partner with would be great. But well done.
Okay. All right, thank you. It's actually, those are actually part of our plans, but because to start, we are going to start with a pilot. So it's going to start with our locality. But of course, we intend to cross borders. We intend to scale to and cross borders and touch other African countries because it's a solution that is needed not just in our environment, but across many countries. Thank you. Thank you.
Thank you. And now, Peter, if you would like.
Okay. Thank you very much, and well done for your presentation. I'd like to make a few comments and possibly tending towards advice because electronic medical record is no longer new, even in the public sector. I would like you to quickly go through Federal Medical Center in Ebute Metta. They are actually using the cards per person, per patient is $3 equivalent, $3. They are bringing on board about 5,000 every month. And not only are they using it for payment, they are actually connecting it with the entire process of Medicare, including information from equipment. So they've gone quite far. It's not in concept stage anymore that we are thinking. But I like the idea of cross-border because right now they are focusing especially on government institutions. And today I can tell you that close to 40 are using the EMR, which I'm talking about. I can get in touch with you. I can send you more information to look at that. But my question is around
we love that,
protection.
Sir. We really appreciate that.
Yeah, no problem. I'm even writing a case study on them so I can share that with you.
I will introduce you via email.
Awesome.
So the question for me is around data protection. The minute you are going from one health facility into another and storing everything in the cloud, what are your backup plans for cyber attack? And then the second question is around technology acceptance model. Yes, you can give people things for free, but here it has to do with technology. Those in the health institution, how are you going to help them, convince them, motivate them to be able to accept technology, to be able to deploy for this? But thank you very much. Brilliant presentation.
Okay, so to answer this question, I'll hand over to my colleague, John Paul.
Okay, good day, Mr. Peter. I'd like to talk about the issue of data protection. Cybersecurity is a major threat all over the world right now. So a technique we want to use to combat it is more or less a two-step technique. We want to use our architecture, that is the back-end architecture. We cannot keep the data in one point. Let me give you an instance. So let's assume that hospital A has a patient's record. Let's call this patient John. Then hospital B has another patient record. Let's call this patient, let's say Sam. Now, once Sam has malaria, it will be ticked from hospital A. Once it gets to the back end, we don't put everything on one data source. No, we scatter it all around. the back end will now be like a collection of different networks whereby the malaria result of Mr. Sam will be coming from a different API. The typhoid result of Mr. Sam will be coming from a different API. So even if one of our data sources is breached, we can simply cut it out to protect the entire architecture. That's the first step. That by the back-end architecture, we're going to put the data in different databases so that it will be so that hospitals will simply just be calling APIs to get data. Then the second part is we understand that this data is very, very important. That is why we want to make use of PCI DSS compliant security, which is the kind of security used by banks to protect ATM pins, to protect passwords and ATM cards, because we understand that medical records are as important as your card details. So we want to get PCI DSS compliant data frameworks to use to protect this data. That is how we plan to protect against cyber hacks and cyber attacks. Thank you.
Thank you. I think we have time for two more questions. Darius and Anil, if we make it quick. I do want to turn attention also to Ashipi's question just for to consider going forward.
Okay, so very quickly, in your pitch deck, you talk about a competitive landscape, and you mentioned the direct competitors like Athena Health and Helium. And your response to that is that your product is differentiated and will compete on cost, but you don't actually explain how. Helium Health, they had a $10 million Series A in 2020. They just acquired UAE booking software Medi. They've got traction in the market. So their business model seems to be similar to yours. They're working with the Nigerian AIDS organization, and they're also working with private public hospitals. So how do you beat those guys when they've got they were founded in 2016, so they've got 6 years on you?
Okay, while it's true that they are currently one of the largest players in the market, but the thing is, within current competitive landscape, is that the market is really fragmented. That is, while Helium is one of the best funded, they haven't even scratched the surface really, because there are so many hospitals that are still using paper-based systems. And another mistake people make is that Lagos is not Nigeria. That is, Lagos is just one state out of 36. Yeah, it is the commercial capital, but once you step outside Lagos, it's an entirely different ballgame. The market is really wide open. And the truth is that Helium, as well-funded as they are, they haven't scratched the surface. So we intend to go into this market, and we intend to stake our claim to the market. Secondly, we intend to differentiate ourselves using a niche market. That is, we're not going after private hospitals necessarily. Yes, we are also going after, they are not our primary, the secondary level of care is where we are after, secondary level of care. That is, whether it's private or public, but we are also targeting, Helium Health hasn't really gone very far outside Lagos and Abuja, which are the commercial nerve center and the state and the nation's capital. But we believe that we can actually enter the market in these other areas that are not necessarily Lagos and really stake our claim to the market.
Thank you. Anil, if we could...
Can I add to what my colleague said?
Sure. And then we'll make it very quick.
Okay. Another thing is, yes, Helium has the track record already, but this is the thing about our own solution. Helium requires people to learn how to use the platform. You have to go to the hospitals, you have to orientate them. But the point is, we don't want our platform, you don't need to actually do that. You just simply, how do I put it? Imagine a Facebook for hospitals. All you just do is log in and your hospital has its dashboard to work with at any time. So we don't necessarily need a customized hardware, or you need specialized software. When you just need it, once you just open your hospital, you just log into the website, you have an account, then we now conduct the know your customer. You have to now submit your certification from the government that yes, you are a certified medical institution. Then you start operating. So that way, we are able to keep our costs as low as possible.
Thank you. Yes, it's I will try to make it short. First question around consistency between the complexity of the IT integration and this very small level of CapEx you have in your business model. And second question is, if you want to take the market, you need the network effect to be effective in terms of data collection and integration. And so how do you build this network effect? And this network effect is not totally integrated in your business plan, because if I'm not mistaken, you are targeting 20, I would say only 20 hospitals in 2025. That seems a little bit small to create this network effect. So one question around consistency between the complexity and the CapEx in the business model, and the second around the network effect and how do you build the network effect to scale, in fact.
Okay. So, because okay, to talk about our low CapEx in our business, plan, there are two major things we need to start off now. Number one, a cloud-based hosting service, and number two, a reliable architecture to serve as our phase one protection against data breaches. We don't necessarily need customized, specialized softwares or specialized hardware, because most of these things are more or less third-party solutions. Now, in order to talk about the network effect, the projections we used for our plan we didn't want to sound too optimistic. We consider the worst case scenarios we can actually imagine. That was what we said to use. Okay, if we can break even in this very, very bad case scenario, then what will happen if we decide to now consider a normal market? Because now, like I explained to you, the thing about the network effect is that we want to now, in fact, in marketing, we want to adopt the technique Intel uses. Instead of we are a company trying to serve the hospitals, but instead we'll now be creating awareness with the customers, or rather with the patients that use those hospitals. So at the end of the day, when more patients hear about this solution, they now go to the hospitals and now say, oh, why aren't you using this? I'm supposed to access my data here. I'm supposed to be able to access my data from your hospital. Before you know it, the hospitals will climb on board by virtue of the fact that their patients are putting pressure on them to use it. So it's our marketing strategy that will help drive this network effect for us. Thank you very much.
Thank you, and thank you so much, team. I believe there have been quite a few questions in the chat. Is this a concept? Is it running government health centers? Lots of things to consider. So I recommend all of you read through the chat quickly. The rest of the judges, if you want to hop onto the link provided in the chat to the next meeting, I will see you all there. Nuretti also provided a last comment. I will also be introducing all of you via email so that judges can be in contact with you, and you can contact the judges exclusively back and forth. So with that, judges, if you don't mind hopping on over, I know that team is ready to roll. Thank you so much, Team Saturn. You guys crushed it. Great job today.
Thank you very much.
Thank you.
Thank you. Everybody.
So the questions, do we reply in chat box or can we respond?
You can respond via email once I send those emails if you want to.
Okay. Thank you.
Of course.